Hello, and welcome to the information session on the Adult Gerontology Clinical Nurse Specialist concentration in the DNP program at LSU Health Science Center School of Nursing. I'm Dr. Deborah Garby. I serve as Associate Dean for the graduate programs, as well as Program Director for the Adult Gerontology Clinical Nurse Specialist concentration. So welcome. You might be asking yourself, what is an adult gero clinical nurse specialist? AGCNS in general is an advanced practice registered nurse, one of the 4 APRN roles recognized universally across the country. So that includes the nurse practitioner, the clinical nurse specialist, the nurse midwife, and the nurse anesthetist. The adult gerontology CNS provides expert care to adult gerontology patients with complex health conditions addressing acute and chronic healthcare needs. The adult gerontology CNS has education and expertise with health promotion, disease prevention that impacts patient outcomes across settings, such as hospitals, private practice, or clinics, and along the wellness-illness continuum. In fact, a CNS can practice in multiple areas, and you'll see that shortly in the next slide. So the CNS is a clinical expert. They focus on a population such as adult gerontology. There are 3 certifications for CNS. One is adult gerontology, one is neonatal, and one is pediatric. Our program is focused on the adult gerontology patient. They could focus on a type of problem, such as pain, wound care, or a setting, critical care, emergency care. A type of care like palliative care, diabetic care, or a disease, CHF, heart failure, pulmonary hypertension, diabetes, stroke. These are just some of the examples. More and more, though, across the country, I'm hearing that programs are incorporating people with an interest in women's health into the adult gerontology specialization. And so this has expanded more options. At one point in history, there was a specialty certification exam for a women's health CNS, but that, because of small numbers, has been is no longer active, but the group and the need for those experts is still there. So they have to meet the broad expanse of all adult gerontology conditions in every system, not just women's health, but they can still focus in women's health. So that was an important distinction. So the CNSs make a great impact on patient outcomes. They increase the use of evidence-based practice and clinical practice guidelines in various clinical settings. They have decreased patient complications, decreased cost, length of stay, promote patient safety, and decrease readmissions, which also plays into increased reimbursements for facilities. When you hear someone talk about the CNS, they will say that they have 3 areas of impact. It's on the patient, nurses, and organization and system level. By providing direct patient care, they promote health, wellness, and improve quality of life. They offer a holistic perspective on APRN management of health and illness and disease. By advancing nurses and nursing practice, they achieve optimal outcomes by ensuring evidence-based practice is used to meet the multifaceted needs of patients and populations, as patients are more critically acute when they approach healthcare for needs. They also articulate the value of nursing to the organization and system at the decision-making level. They influence system change to improve patient care and cost effectiveness. If you look at a typical day in CNS practice, what might it look like? So for a CNS who's in an acute care facility, a hospital, they might start the day off on interprofessional rounds on patients in their population or on their unit. and contribute along the way to patient progress, what might be needed, what kind of treatments, interventions, medications. Later in the day, they might answer consults from nursing or nursing units. Maybe a patient is having trouble with pain management and they can offer recommendations and prescribe for those needs. Maybe it's a family issue and they help coordinate family understanding of what's happening with the patient. They may coordinate a family meeting, and maybe they're consulted by the nursing units because they're having problems with a nurse understanding a certain procedure or their nursing competency as a new grad. And so they can provide assistance in making a difference there. Later in the day, the CNS might be working on project management related to a quality improvement initiative. So they might be making rounds on where projects are being implemented, such as, say, a sepsis bundle or a VAP bundle, and making sure that there's intervention fidelity, that the nurses are implementing the protocol and the guidelines as they were intended. They could answer questions related to the nurses about the new practice change and maybe even collect data. Later in the day, the CNS might be involved in meetings with nursing administration and others, preparing for a magnet visit and magnet designation. That's a huge part of what CNSs do. They are the key to hospitals achieving magnet designation. You might also wonder, can a CNS prescribe? The answer is yes. Because CNSs are certified and licensed, they can apply for prescriptive authority in Louisiana and 39 states. As part of your credentialing, so when you graduate, you will sit for certification. Then you're eligible to apply for licensure and prescriptive authority. You'll need a collaborative practice agreement with a physician for prescriptive authority. You'll need to apply for an NPI number, a National Provider Identifier, which is the main step that you would do to complete hospital privileges and be able to bill for your services. Most nurses, most CNSs work in hospitals. And as you can see, a lot of the hospitals where CNSs work are magnet status or seeking magnet status. So CNSs, as I said, are an integral part of this work. This is data from a 2020 survey, national survey of all CNSs. So why choose LSU HSC to earn your adult Gero CNS? Well, first off, we are the only health science center in Louisiana. And as such, we have experts teaching all your courses, basic science as well as nursing. So we have actual PhD prepared pathophysiologists, PhD prepared pharmacologists, and statisticians. So you're learning from the best and the brightest. We share all resources across the 6 schools in the Health Sciences Center. And our graduates are sought out by employers from the BSN level to the DNP and PhD level. I have currently a 100% pass rate, first-time pass rate of all AGCNS graduates on their certification exam. Another reason to attend LSU HSC. I'd like to introduce the faculty for the program. There's Dr. Jennifer Manning, whose specialty is critical care. She is also the new president-elect of the National Association of Clinical Nurse Specialists. Dr. Todd Tardaville, his specialty is in pulmonary hypertension. He's done a lot of projects as well as research related to improving outcomes in pulmonary hypertension patients. Dr. Linda Leday, her specialty is as a mental health CNS, and she has practiced in a variety of outpatient settings. And then there's myself, the program director. My specialty is perioperative nursing, as well as general acute care nursing. The AGCNS curriculum is available online for you to view these specifics. There are 35 credits of core courses. There are 10 credits in what we call the 3P courses, which is the advanced pathophysiology, advanced pharmacology, and advanced physical or health assessment. There are 25 credits for adult gerontology CNS specialty courses. There are 9 credits related to the scholarly project and 5 credits for practicum related to that project. In total, there's 84 credits and 1,080 clinical hours. To earn a DNP degree, you need a minimum of 1,000 hours post your baccalaureate degree. The scholarly project is the capstone project, a culmination of all that you've learned in your DNP program. And it's a requirement for successful completion of a project and defense to graduate. Our admission criteria are an official transcript, a GPA of 3.0 or greater. If you're English as a second language, a TOEFL minimum score of 550. BLS certificate, 3 references, which will be sent from Nursing Cast, which is the online application system. Some clinical nursing experience and a current unencumbered RN license. Also, successful completion of the interview process. Application information is available online. There are also instructions on how to access Nursing Cast and upload all the required documents. References, like as I said, will be sent an email to a link that goes directly to Nursing Cast for the recommendation. There's no hand delivery of letters or anything like that. It's all electronic directly to the person providing the reference. If you visit the AGCNS homepage on the LSU School of Nursing website, you'll find a video on the homepage that describes the CNS program and the AGCNS role. I also want to refer you to the National Association of Clinical Nurse Specialists link here on the screen, which is a very interesting video that describes the role very well. There are roughly almost a dozen CNSs at the Reading Hospital in Pennsylvania that talk about their role. It's very, very well done, professional. I think you'll find it very informative if you go to the site. It was part of a video competition. And here's my contact information, my telephone number. You can call. I'm here most days, or you can leave a message and I'll get back to you as soon as possible. Also, my email address is dgarby@lsuhsc.edu. So I thank you so much for spending this time and listening to this information. I hope to hear from you soon to be able to answer any questions and ultimately to see your application in Nursing Cast. So regardless of your decision, I wish you well and thank you so much for listening. Goodbye.